Hey guys, welcome back to TLN. Now, the entire conversation around vaccination has been a little bit confusing and overwhelming for many Canadians. So, to clear up any concerns that you may have today, I'm speaking to Minister Michael Tibollo, the Associate Minister of Mental Health and Addictions. Minister, thank you so much for joining us. How are you today?
Fantastic, and it's great to see you again. And thank you for the opportunity to speak today.
Of course, I mean, there's so many concerns that Canadians have right now, especially in terms of the online booking system, pharmacy rollouts. There's just a lot of information overload. So, as of today, in your opinion, how do you recommend people go about the process of getting vaccinated? What is the correct route to take to find out more information and to book those appointments?
So the easiest thing to do, there's two ways of doing it. Either to go online at ontario.ca/coronavirus or mental health. The other thing is to utilize the 1-888-999-6488 number. For those that speak Italian, if you press 3 and ask for an Italian operator or a Spanish operator or a Portuguese operator or German, there are 300 different languages that are spoken utilizing that line. It will give you the place that is the closest and the most effective way of getting your vaccine. So for instance, called that number on Good Friday at 10:30 in the morning, and I got a booking and got my vaccine the same day at 5:30 in the afternoon. So the system works. The other way is to contact one of the participating pharmacies and be able to go into a pharmacy with an appointment and get a vaccine that way. Alternatively, if you listen, you will also find out when there are vaccines available for you to just go and get the vaccine. That's a little bit more complicated because you may be, especially on days like today, a little cold and have to wait in line. But there are numerous ways of getting a vaccine. The issue still for us is making sure that we have enough quantities, but we're doing everything we can and are actually vaccinating over 100,000 people a day now.
So that was one of my questions with the immigrant communities. It is actually just the fact that a lot of these members of the community are a bit older. They don't really understand the online process. So to clear it up, it is possible to book a vaccine using a phone line, get the appointment, everything over the phone, or is the internet still something that's necessary?
No, you can do your appointment over the phone with the number that I gave. Again, I'll repeat it because it's an important number: 1-888-999-6488. And then if you need help in the language other than English, press 3, and that will give you and say the language that you want to be spoken to, and the person will come on the line and do all the booking for you so that you'll get your first date, and typically they give you your second date as well.
And what's the current waiting time on a phone line like that?
I phoned the first time and I got the appointment. I've heard some people say that you do have to wait. I would assume that it's going to take a little bit longer if you're going to ask for help in another language because it has to be routed to whoever it is that's answering in that specific language. But it's very quick. It's very efficient. We've done this with the Italian community and given them the number, and we haven't received too many calls at the office saying that I couldn't get through or there was a problem. And if that has happened, we have actually intervened, made the calls, and we've managed to get through. So it's very efficient.
And with the Italian communities, with the Latin community, there is sometimes a little bit of fear and anxiety when it comes to the vaccine because they don't have as much access to information as the general public. I mean, we're doing our best to get the information out there, but there is sometimes a little bit of a language barrier. So now that you are here speaking to our audience, speaking to the TLN community, what do you want them to know about the importance of getting vaccinated right now?
Yes, the vaccines are safe. There are 4 of them that are approved that have been approved in Canada. The 4 that are approved are all safe. I know that there's been some stories about AstraZeneca not, producing some issues, but all the doctors have spoken about this and have said that the chances of getting any kind of a side effect or a problem with the vaccine is so insignificant. The important thing right now is that we all get vaccinated. The most important thing that we can do is ensure that as many of us get vaccinated as possible so we achieve herd immunity. And by achieving herd immunity, we'll get to the point where we can start opening our businesses, start celebrating the different festivals in the city of Toronto and across the country, all the different festivals that unfortunately have been shut down now for so long. But I know some people hesitate to get the vaccine. My mom's 82. She got the vaccine. I went out, I got it. I had a little bit of the aches and pains, which is what they say you're going to get. But at the end of the day, by being protected against this terrible virus, it's one less person that's going to end up potentially in the hospital. And that's another huge concern. The more we get vaccinated, the less we're going to need to have the ICUs fully occupied, and the strain that we're putting on our incredible healthcare workers that are working around the clock to keep people alive.
And you did mention the AstraZeneca vaccine, and there has been a little bit of hesitancy, but we've also seen a lot of people that are younger pushing to get the age limit lowered so that all of these excess vaccines, I think today there was some in Downsview Clinic. Is there
Yes.
any talks, any discussion to potentially lower that age?
We're continuing to lower the age as we see that we're achieving, uh, or that we start to see that the number of people coming for vaccines is lowering. I think you've heard now that 25% of the vaccines from across the province are being rerouted to the areas where we have the greatest concern, so the hotspots in the province. In addition to that, in the hotspots, you don't have to be within the age groups. It's anyone who resides within those areas. So we're doing everything we can to get the vaccines into the arms of as many people as possible. Our only real limitation right now is the number of vaccines coming into the province. We built up a network of nurses and doctors that are vaccinating people that we could do up to 300,000 people a day. And we're around 100,000. We're limited only by the supply we have at this point.
And now, Minister, I do want to talk to you about, a future potential situation. Let's say in a few months we've reached the ceiling of the amount of Canadians that are willing to get vaccinated or want to get vaccinated, but we're not necessarily at the 70% or the number that we need in order to achieve herd immunity. How is the government planning, to prepare once we get to that situation, either encouraging more vaccination or returning to normalcy before we hit that number?
So studies have been done that actually show that 82% of the population are prepared to have a vaccination if the vaccine is available. So we believe we will achieve herd immunity. The premier had said that in the province of Ontario during this lockdown period, and that was the purpose behind the lockdown, was to reduce the amount of contact between people and give us a chance to catch up with the vaccinations. So at 100,000 a day, by the end of the lockdown, we should have over 40% of the population with at least one vaccination, one vaccine. The second one, with the timing, we should be able to have that done, most people by June, July. And we're hoping that by September, we will achieve that herd immunity number. And of course, even with the vaccines, we have to remember just how dangerous the variants of concern are, that even with the vaccine, you have the possibility of getting COVID-19. The symptoms are going to be a lot less severe, which means you're not going to end up in an ICU, but you still could get it. So I caution everyone that even if you get the vaccine or if you've only received the first one, you're not immune to it. Make sure you continue masking, make sure you continue washing your hands, continue maintaining social distancing. As we move forward, the province will start opening up again because that's what we all want. This is not something as a government that we wanted to see happen, that we've got to lock everything down. But the health and safety of every person in the province of Ontario, I'd say that it's the same thing across Canada. We want the people to be healthy and safe. And this is playing havoc on everyone's mental health. I certainly know that. But I encourage everyone, let's continue working together. Let's continue maintaining the social distancing and looking after ourselves. We will defeat this virus and we will get back to normalcy.
So, on the topic of mental health, of course, there are a lot of side effects to this pandemic, and one of those is the mental health of Ontario residents. So, is there anything in these last few weeks or the last month that you can announce and share to our audience of how the government is investing to help mental health?
Well, that's an excellent question, and we are working diligently to, number one, look after people's mental health. And we've spoken before about the different virtual services that we have available. They continue to be available. As a matter of fact, over 62,000 people right now are using internet-based cognitive behavioral therapy and other supports that are available through ontario.ca/, mental health. There are also phone numbers that you can call, and you can find them on the website for kids, for helplines and supports that way. We also understand the tremendous pressure that our frontline workers are facing. So we've developed a program, online support for them as well. There's over 6,000 people that are accessing that service. These are all free of charge. They're all confidential. And the other great news that hopefully is going to be of benefit as well, is that the province has looked at the benefits that are available to people as a result of sick days. And the province is working to develop a strategy in conjunction with the monies that are set aside at the federal level so that hopefully we can take some of that anxiety and burden off of individuals that are forced to stay at home because of COVID-19 and have to make a decision. Do I feed my family or pay my mortgage or pay my rent and therefore go to work even though they may be sick? So we understand that more needs to be done that way, and we are working to ensure that people have the supports they need for the benefit of their health, their sanity, their mental health, and everything that they need to make sure that their families are safe.
Minister, thank you so much for joining us and for taking the time to speak to our community.
My pleasure, and it's always a pleasure to join you and catch up. Thank you.